Today, we're going to talk about something that affects millions of people worldwide: hip pain. It's a major concern in today's world, and finding relief from it is something most people are looking for. So, if you're one of those people struggling with hip pain, you've come to the right place. Hip pain can really bring you down and make everyday activities a challenge. Whether it's caused by an injury, arthritis, or other factors, finding effective solutions is crucial for maintaining your mobility and overall well-being. That's why we're here to help. First things first, let's understand what hip pain is all about. Our hip joint plays a crucial role in our body, enabling smooth movement and supporting the weight of our upper body. When this joint gets damaged or inflamed, it can lead to pain and discomfort. So, understanding the underlying causes is essential to figure out the best treatment options for you. Now, let's talk about instant hip pain relief. We know you're eager to find some quick solutions, and we've got you covered. But before we continue, check the description below to find a lasting relief from hip pain with an expert program. We'll share proven techniques and remedies that can provide you with instant relief from hip pain. Say goodbye to discomfort and regain your mobility with these effective solutions. Let's take a look at the possible causes of hip pain. There are several factors that can contribute to this condition, and we'll cover some of the most common ones. First, we have osteoarthritis, which occurs when the protective cartilage in our joints breaks down over time. This causes the bones to rub against each other, resulting in pain, stiffness, and inflammation. Next up, we have bursitis, which is the inflammation of small fluid-filled sacs called bursae that cushion our joints. When these sacs get inflamed, it can cause pain and swelling in the hip joint. Tendinitis is another common cause of hip pain. It's the inflammation of tendons that attach muscles to bones, and it can result in pain and stiffness in the hip joint. Hip fractures are more common in older people and can cause severe pain and difficulty walking. A break in the thigh bone that forms the hip joint is what we call a hip fracture. Hernia, a bulge in the abdominal wall, can also cause pain in the hip or groin area. It's another factor to consider when exploring the causes of hip pain. Lastly, muscular strains or tears can occur due to overuse or sudden movements, resulting in pain and discomfort in the muscles around the hip joint. If you're experiencing hip pain, it's important to see a doctor to determine the underlying cause and receive the appropriate treatment. Don't hesitate to seek professional help. Now that we've covered the causes, let's move on to diagnosing hip pain. Proper diagnosis is crucial for effective treatment. A healthcare professional will evaluate your symptoms, medical history, and may perform physical examinations and imaging tests like X-rays or MRI scans to accurately determine the cause of your hip pain. When it comes to treatment, there are non-surgical options that can provide relief. Medications like non-steroidal anti-inflammatory drugs and pain relievers can help reduce inflammation and alleviate pain. Physical therapy is another great option. It's a customized program designed to strengthen the hip muscles, improve flexibility, and promote joint stability. Plus, using assistive devices like crutches, canes, or walkers can relieve pressure on the hip joint and aid in mobility. And don't forget about making lifestyle modifications. Maintaining a healthy weight, practicing proper body mechanics, and avoiding activities that worsen the pain can all contribute to managing hip pain effectively. However, in some cases, non-surgical treatments may not be enough. That's when surgical options come into play. Procedures like hip replacement, arthroscopy, and hip resurfacing aim to repair damaged tissues, restore joint function, and alleviate pain. It's important to consult with your healthcare professional to determine if surgical intervention is necessary for your specific situation. Now, let's talk about lifestyle modifications that can help manage hip pain and improve overall joint health. These changes can make a big difference in your everyday life. Maintaining a balanced diet with nutrients that support joint health, staying hydrated to promote joint lubrication, engaging in low-impact exercises like swimming or cycling to strengthen the hip muscles, and improve joint stability, all these factors play a significant role. And let's not forget about stress management techniques like meditation or yoga, which can reduce muscle tension and promote relaxation. Exercises and physical therapy are also important in managing hip pain. A physical therapist can guide you through specific exercises and stretches that can improve hip joint mobility, strengthen surrounding muscles, and reduce pain. It's a great way to actively participate in your recovery process. Remember, if your pain is severe, accompanied by sudden swelling or inability to bear weight on your hip, or if it persists despite conservative treatments, it's time to seek medical attention. To wrap things up, hip pain can really impact your daily life and overall well-being. But by understanding the causes and implementing appropriate treatment options, you can effectively manage hip pain and regain your mobility. Take care of your hips, stay active, and enjoy a pain-free life. Don't forget to check the description below for lasting relief from hip pain with an expert program.